A leader at the CDC was one of the first people in the U.S. to flag an unknown pneumonia in Wuhan, China, that later became the COVID-19 virus. That early warning sign was only the start of CDC's role in managing the pandemic. That leader is Dr. Schuchat, Principal Deputy Director at the CDC, retiring this month after 33 years. She's a finalist for the Paul A. Volcker Career Achievement Award given by the Partnership for Public Service. Dr. Schuchat, welcome to the program.
Thank you so much.
So you were one of the first people in the U.S. to see the warning signs of COVID-19 in China. Talk about what you saw and what you did.
There was an alert on December 31st in the listserv ProMed, and I saw that and immediately contacted our staff who run the respiratory viral work, including asking them to connect with our colleagues who were in China and to understand whether we were hearing anything and what else might be going on. For many of us who had worked on the SARS response in 2003, that first alert sounded very eerie, like a new virus might be causing serious problems. But early days, it's hard to know. And so the first thing was to get as much information as we could very quickly.
And were you able to get the information that you needed?
Well, within a few hours, we found out that the numbers were larger than what was in that early report, and that very little was known yet. But of course, as the weeks unfolded, the seriousness of the issue became more evident. At CDC, we activated our emergency operations center. We deployed people to airports. We were very, very active during the month of January. And then, of course, in February, we started to see additional spread here in the United States.
So obviously one thing that you need to do is warn the public and public officials. How did you do that?
Yeah, CDC has a number of ways to get the word out. So one of our first steps was what we called a HAN, a health advisory note, health alert note, where we sent what we knew and what we thought clinicians and public health ought to do about what we knew. We did that in early January and also began doing briefings for the media. So, information is currency in an emerging infectious disease, and in the various ones that I've had to respond to, the more we communicate, the more the public has the information they need so that they can protect themselves.
You also had to really work to earn the public trust at the CDC. What were some of the things that you did to do that?
Yeah, trust is such a critical issue in any scary situation. And over the years, we have had ups and downs in the reliability of CDC or the trust that the public gives us. And of course, the coronavirus pandemic has been a pretty tough one for CDC and for government in general. But we are committed in our efforts to be transparent, be honest, open, express empathy, let people know what we know and what we don't know, be honest about that, and to explain what we're doing to try to find out more and to protect people. We also like to give people actions that they can take so that they can have some control over the situation. Those are the classic principles of risk communication and what we've really been training CDC staff on since the bird flu issue of the 90s.
And Dr. Schuchat, I know that you've been working on COVID nonstop, obviously, since that day a year and a half ago. I know you've had a long career other than that. So can you tell us about some of the other diseases that you've worked on?
Yeah, I've been so privileged, in 33 years at CDC. I came in as a disease detective and was initially working on bacterial infections that can cause meningitis and also infections that can affect pregnancy. So one of my first focus areas was on preventing group B strep infections in pregnancy. And happy to say that based on guidelines CDC worked on together with the obstetric and pediatric community, we've prevented about 100,000 babies from being born with that terrible infection that can be life-threatening. But I got to work on many other emergency responses, the H1N1 pandemic of influenza, the Zika terrible outbreak with the impact on pregnant women, particularly the babies, and then on the Ebola West Africa response. Between epidemics, most of my work has been on vaccines and other infectious diseases that can be prevented.
You know, Dr. Schuchat, you're known for mentoring young scientists. Why is that a priority for you?
Well, of course, I benefited from incredible mentors and sponsors early in my career. And I have to say there's some selfish reasons. It's just a lot of fun to work with new people who are new to the public health arena, or people who are young and very eager and not yet cynical or jaded, and to try to help continue their optimism and to continue to support their motivation. You know, I'm such a champion for public health in general, and see the possibility that individuals can, with almost any kind of interest and skill set, can find their way in public health. And so I enjoy helping people navigate their careers and learn how to really make a difference, because it's an extraordinary thing to get to work in public health and in public service in general, where your work is fun and interesting, but it also really matters.
And just looking to the future, are we ready for the next pandemic?
We have a lot of work to do. I think that this has been an awakening moment for the government, for the public, for the nation, that the U.S. was not as prepared as we thought we were, and that in general, we really need to invest in long-term commitments to that frontline public health capacity at your state and local level, to the laboratory infrastructure, to our data infrastructure, so that what the public needs is there, and that we can not just react quickly, but predict and foreshadow and really get ahead of these viruses. The viruses are still out there, they're mutating all the time, and there are going to be new ones. And of course, we're not done with this one.
Well, Dr. Schuchat, thank you so much for your work, and congratulations on your nomination. Thanks for joining us.
Thank you so much.